Hi viewers, welcome to another live session with BS Hospitals. My name is Arun. Today we are going to be discussing about breast cancer and its treatment. Everyone knows someone, a family member, friend, or a colleague who has battled breast cancer. Based on current and public interest, we want to help address common concern as it pertains to breast cancer. So stick around, we have a lot to discuss today. Today we have with us a renowned surgical oncologist, Dr. D. Suresh Kumar, with 25 years experience. Known for his humbleness and compassionate care, Dr. D. Suresh Kumar has a stellar academic background and has received many awards and accolades for his academic brilliance. He has many paper presentations and publications to his credit. Welcome, Dr. Suresh Kumar. Thank you for joining us today.
Thank you, Harun. First of all, good evening to everybody, and thanks for my kind introduction. So myself, Dr. D. Suresh Kumar, Professor of Surgical Oncologist. I'm graduated from Coimbatore Medical College and done my post-graduation in All India Institute of Medical Science, New Delhi, and done my MCH Surgical Oncology in Cancer Institute. Presently working as a Professor of Surgical Oncology in Tamil Nadu Multi-Super Speciality Hospital and a consultant for VS Hospitals. So my special interest in treating breast and gynec cancer and gastrointestinal tumor, gastrointestinal cancer, and special interest in minimal invasive, especially advanced laparoscopy and robotic surgery.
That's great, Dr. Suresh Kumar. Let's start off with the question. What is breast cancer and how common it is?
See, first we have to understand what is cancer. The cancer is nothing but abnormal proliferation of the tissue. So it means abnormal multiplication of the tissues. It is basically occur any cells which has an imbalance in the birth and death. It means that if there is an excessive birth or there is an abnormal death. So which leads to the proliferation of the cells. So this abnormal proliferation leads to the cancer. So why it is occurring? If there is any change in the birth gene control or any change in the death gene control, which leads to it. If this occurs in the breast tissue, then the breast cancer occurs. Okay. How common if you see, generally if you see women 2 decades before, the cervical cancer is commonest cancer among the women. Now presently the breast cancer is the commonest cancer. If you take 100% of women cancer, the breast cancer constitutes almost 27.7%, followed by cervical cancer, which is 16.5%. So the breast cancer is the commonest, especially in the urban area, which is very common.
Thank you, Dr. D. Suresh. What age does breast cancer occur?
So generally the breast cancer is common in the middle age group, which is almost like 50 to 69 years, which is very common, which almost like 40% of the tumors occurs in this age group. The next common is in the younger age group, but if you see in Indian scenario, now we are seeing a lot of younger woman cancer, young age woman cancer, breast cancers are there, which constitute about 35%, and more than 70 years, it constitute about 15%. So commonly occurs in the 50 to 70 years of the age is the commonest age group for the breast cancer.
Thank you, Doctor. Dr. Suresh Kumar, can you please educate us on breast cancer symptoms?
Yeah. See, this is very, very important because the most of the patients who tell us the painless progressive breast lump is the most important signs for the breast cancer. But this is very important because most of the women, they ignore this because it is painless. On the other side, if you have a painful lump, obviously you will seek an early attention and you will see the physician. But this painless is very dangerous and you should not ignore it. And other changes, like if you have a nipple retraction, nipple discharges, and if you have a nipple ulceration, skin changes, or if you have swelling in the armpit, these are all the signs of the breast cancer. Sometimes, unfortunately, the patient who present with an advanced breast cancer, especially like stage 4, if you have a bone metastasis, they will present with bone pain or fracture at trivial injuries. So these are all the some cancer, and depends upon the which organ is affected. Like if you have a lung involvement, you may have a cough and breathlessness. If you have a brain metastasis, you may have a vomiting and headache, liver metastasis, abdominal pain, and the jaundice. These are all this. But the most common painless progressive lump is very important, and this especially in the middle age group. Until proved otherwise, it is a malignancy. So you have to keep in mind, painless is more dangerous than the painful lump.
Thank you for elaborating, Dr. Suresh. What are the types of breast cancer?
See, breast cancer, if you see generally the cancers, we divide the cancers into the carcinomas and sarcomas. See, carcinomas, if you see the breast as a duct component and lobular component, which any cancer arising from this component will lead to a carcinomas. The supporting tissues like mesenchymal tissues, like supporting fat, this when the cancer occur in that, it leads to the sarcomas. So the most common breast cancer is carcinoma, especially that is the cancer arising from the duct, that is called ductal carcinoma, followed by lobular carcinoma. If it is occurring in the mesenchyme, we have this phylloid tumor, which again borderline and malignant varieties are there.
Okay, doctor. How important is breast cancer screening, and how often one should get screened?
Yeah,
this
is very important part of the session. See, breast cancer screening is very, very important. I emphasize that the breast cancer screening is important. Why? There are many reasons for that. If you diagnose the patient with the screening, you are going to pick up the lesion with very early. So you will be diagnosing at a very early stage, which leads to the high chances of cure. This is one part. So the screening is very important because we will be diagnosing at an early stage. The other two important factor why I want to emphasize that if you diagnose at an early stage, so what is the biggest advantage is we no need to go for removal of the breast cancer. We can go for an organ preservation, especially breast conservation surgery. So which is very important for a woman to have a very confident in her life. So the second advantage, you can preserve your breast. The third, the biggest advantage, as we all know, the financial issue. If you diagnose the cancer at an early stage, the single modality of treatment, like especially the surgery alone, is more than enough. If you diagnose at an late stage, like an advanced stage, we need a multiple form of treatment, especially surgery, radiotherapy, chemotherapy, immunotherapy, which all leads to the lot of financials will be there, issues will be there. So the advantage of screening is very important. First thing is curative, and second, you can have a breast conservation. You no need to remove your whole breast. And the third, financial part. So I emphasize the screening is very, very important for the age.
Okay. What exactly causes breast cancer?
See, this see, almost if you see that 10 to 15% of the cancers, breast cancers are familial or hereditary. The rest of the 85% of the cancers are sporadic. It means that we don't know what are the causes, but many of other contributing factors. If you see, the most important factor is an high estrogen exposure in a life, because that is breast cancer is an estrogen dependent, hormone dependent cancer. So any woman who have an high estrogen exposure in her life, example, patient who is having an early menarche and late menopause. So this leads to a long exposure of the estrogen. And the patient who is having nulliparous, who doesn't have any children. So they will also have an exposure for the estrogen, and late childbirth and non-lactating woman. So this high estrogen, these are the conditions where you will get an high estrogen exposure. And the other causes like OC pills, oral contraceptive, especially high estrogen alone pills or leads to the this thing. And other things, what I will say is that obesity and high fat intake, because this obesity and fat intake will also leads to the peripheral conversion or the peripheral production of the estrogen, which leads to the breast cancer. So these are all the factors. The hereditary 10 to 15%, the sporadic, which we don't know, but the attributing factors are high estrogen cancer.
That was very elaborative, Dr. Suresh Kumar. How is breast cancer diagnosed?
Yeah. See, breast cancer generally diagnosed, what we say is a triple assessment. The triple assessment means which include clinical examination and radiological examination and pathological examination. So the clinically, as we see, as I told, that any lump in a middle-aged woman, until proved otherwise, is a malignancy. And we will see certain characters of the lump, which always against it will contribute whether it is a cancer or non-cancerous. Other than clinical part, then the imaging. If you see the mammogram and sonomammogram or MR mammogram, which are all used to diagnose the cancer, breast cancer lesion. The foremost important is this clinical as well as radiological things will suggest, or it may suspicious, but the pathological assessment either by a fine needle aspiration. Now the gold standard is true cut biopsy, the core needle biopsy, which is very, very important, which will establish your diagnosis. Not only it will establish your diagnosis, it will give the character of the tumor cells. It gives the molecular pattern and molecular signature of the tumor. So with this clinical assessment, that is called the triple assessment, clinical, radiological, and pathologically, we can diagnose the breast cancer.
Doctor, just this question popped up. Does breast cancer screening painful?
No. See, generally, like if you see that the mammogram, sometimes it will be a painful in the sense they may be compress the breast to take the thing. But if you go for a sonomammogram, but sonomammogram, it's little like the digital X-ray mammogram is the gold standard. So it may be a little painful, but you have if you diagnose at an early stage, it is more valuable.
Is there any stages? What are the breast cancer stages, Dr. Suresh?
So breast cancer, we generally, for the treatment purpose, for the prognostic purpose, we divide the cancers into 4 stages. So stage 1 and 2, we call at an early breast cancer. As I told, that early breast cancer, we have an high chance of cure rate. And the stage 3 is a locally advanced breast cancer, which is also with the advent of multimodality treatment and the latest advent of molecular and immunotherapy. We are almost like more than 50 to 70%, we are able to cure the patients. Stage 4, generally, it is an incurable disease. But as I told, with the evidence of the better drug like immunotherapy and chemotherapy, so we still in a stage 4, which is generally called as an incurable. Now we have a set of people, like especially oligometastasis or a patient who very well responds to chemotherapy or immunotherapy, they may get a cure. So in a breast cancer, even in a stage 4, in a present situation, we can aim for a cure.
Great, doctor. How is breast cancer treated? Can you educate us?
So this is very important. So not only the breast cancer, almost all cancer, it is a multidisciplinary approach. It means that the multidisciplinary means we need a radiologist, we need a pathologist, and surgical oncologist, medical oncologist, and radiation oncologist. This is a team work, and it needs as we discuss, and depending upon the patient's conditions, and the stage of the disease and molecular pattern of the disease, we will decide the treatment. So especially the treatment, as I told, early breast cancer, we may get away with the surgery. And in case of locally advanced, we have to give a multimodality, either a chemotherapy followed by surgery and radiotherapy, or surgery followed by chemotherapy, radiotherapy. It depends upon the multidisciplinary board decision and the patient condition also.
Dr. Suresh Kumar, when will the surgical oncologist comes into treatment plan?
Yeah. See, the role of surgical oncology in any cancer, especially a breast cancer, first we need to diagnosis by doing a biopsy. And one more point I want to emphasize, that the people have a common idea that the biopsy will spread the disease. It is a false belief and it is a myth that the biopsy will never lead to the dissemination of the disease. It is a per se, but the cancer per se and the pattern of the cancer it leads. But biopsy is very important. Without biopsy, we cannot prove that it is a cancer, one. And without a biopsy, we cannot decide what kind of chemotherapy, what kind of hormone therapy, what kind of immunotherapy. So it has to be decided. So the biopsy, it is very important, is generally done by the surgical oncologist. Then coming to the treatment part. So treatment part, as I say, surgery. So there are variety of surgeries are available for the breast cancer from the beginning of the radical mastectomy, but presently it has been weaned off. Now we have been in the modified surgery, the removal of the breast and axilla, and latest, as I told with that one, we have been doing a lot of breast conservation therapy, which also given equal results after removing the whole breast. And the most important point that the surgeon's role is the oncoplastic. As I told previously, the breast, a woman without breast, obviously some psychological issues will be there. So with the evidence of this oncoplastic surgery, we can able to give the normal or near normal breast contour so that the patient will not have a psychologically benefit. And presently, with the various technical, like as we previously, when you do radical surgery, we will have an arm edema, everything will be there. But in a present scenario, we can avoid all this by doing a sentinel lymph node, where we can avoid an axillary lymph node dissection, just identifying that particular lymph node, and then by doing the frozen section or a biopsy, we can avoid the axillary dissection. So these are all the latest advantage of the surgical management, where the surgical oncologist will be evident.
You really play a very important role, Dr. Suresh.
Yes. If one more thing, any solid malignancy, surgery is very important. No cure of cancer without a surgery, especially in solid malignancy.
Dr. Suresh Kumar, basically patients, if they come to know there's a breast cancer, the first question pops up is like, once we take the treatment, undergo the treatment, is it curable? Can you please emphasize on that?
Yes, see, almost all cancers, if you diagnose at an early stage, it is curable. Why I'm saying is, it is not that Suresh Kumar or somebody else, it is evident, because as we know that the allopathy medicines are evidence-based medicine. So we have evidence to say that if the patient in an early stage, for example, stage 1, or there is another entity called stage 0, DCAS, the pre-invasive malignancy, that is 100% curable. In stage 1, you will have almost like 95 to 98% of cure is possibility with the stage. So the cure of your breast cancer, it depends upon the stage, and presently not only the stage, and it also depends upon the molecular signature or molecular pattern of your cancer. So depending upon that, we can able to cure. The cure is possible even in a stage 4, as I told. there is a called oligometastasis. I told you, if the cancer has spread to a single organ or a treatable organ, then we can achieve an aim for the cure, even in a stage 4. So the idea is you need to have a multidisciplinary approach to treat the cancer.
Really promising and encouraging, Dr. Suresh Kumar. What is the survival rate for breast cancer?
Yeah, now only as I told that the stage 1, generally more than 95 to 98% of the survival for the 5 years to 10 years prognosis. And if it's stage 2, roughly around 80 to 90%. Stage 3, 50 to 60%. Stage 4, it's not it is not curable, but in certain, as I told, certain type, we can get a cure up to 35 to 40%. So the survival rate will be depending upon the stage.
Thank you, Dr. When should one consult an oncologist?
Yeah. The one is, if the patient itself having a suspicious of fear of cancer, they should consult an oncologist. Otherwise, if they diagnosed either by a scan or by a mammogram or by a biopsy, if they found to have a cancer, then it is always better to consult a oncologist, either a surgical oncologist or medical oncologist or a radiation oncologist, because oncologist will always have in mind of to go for a multidisciplinary approach, because the most of the patients, they think that once we remove the breast cancer breast tissues and the cancerous part, the treatment is over. It is not the answer. It is always a multidisciplinary approach to get a maximum cure. So for once you diagnosed as a cancer, or if you have a suspicious in your mind that you're having a cancer, it is better to get a oncologist opinion.
That's great, doctor. Doctor, prevention is always better than cure. Can you please elaborate on breast cancer prevention, because this is very important for us.
Yeah, the more important is the breast cancer prevention. As we know, the screening is basically for the early diagnosis and treatment. So now if we have to talk about the prevention, so prevention, how we categorize is especially, as I told, the 10 to 15 high risk and low risk people or general population. The high risk population, as I told, that hereditary cancer patient, like as an example, I want to say that breast cancer gene. So if the patient who has a breast cancer gene positive, it means that in her lifetime, chances of getting a breast cancer is almost 60 to 80% in her lifetime. So these people has to be one thing, we have to do a genetic testing. Once the genetic testing is positive, we have to give a genetic counseling, and then we have some preventive measures other. One, they should be in very close follow-up or chemo prevention, especially the tablet. There are some anti-estrogen tablet like estrogen or relaxofin can be used to prevent. And sometimes we can have a preventive surgery like risk reducing or preventive surgery, especially we can go for a bilateral prophylactic mastectomy, or you can consider for a oophorectomy. So these are all the procedure where we can reduce the or prevent the cancer in this high risk patient. The rest, as I told, other sporadic people, as I told, that we need to have a very good physical activities and very good food, like especially vegetables which are rich in antioxidants and low fat diet. And you have to maintain your health, avoid obesity or overweight, and regular physical exercise. This is very important, not only for this cancer and other cancers also, and especially you should avoid tobacco and alcohol drinking. These are all the prevention. The single word, healthy, happy life. That is more important. Okay. So by this way, we can prevent.
Okay. You really explained us in a very simple language, Dr. Suresh Kumar. What is your take-home message?
Yeah. Take-home message, what I will emphasize is, one, every woman, see, the woman is the main important, they are the pillar of the family. Okay, so they should, this problem is now, it is going to be a global, and as I say, the incidence is increasing, especially breast cancer. Cancer is increasing tremendously. So every woman should aware about the breast cancer, and they should know what are all the early signs and symptoms of the breast cancer. One, and the other thing is they should go for a screening. As I told, the screening advantage, the screening should be started general population 40 years. From the 40 years, every year you should go for a mammogram. And high risk population, depending upon the age of the previous family history, we have to screen 5 to 10 years before them. This is very important, and they should go for a self breast examination and the clinical examination by the physician. These are all very important screening thing. And the most important, once you get diagnosed, get your local oncologist, and always get a multidisciplinary approach and aim for the higher cure rate.
Thank you so much, Dr. Suresh Kumar, for your valuable time and educating us on breast cancer and treatment options. Yes, viewers, being diagnosed with breast cancer can feel scary, frustrating, and even hopeless. If you or a loved one is facing this disease, it's important to take advantage of the many resources available to you. Don't hesitate to talk to your family first, consult your trusted family physician, and discuss about your treatment options. You may even want to get a second opinion before making a decision. You should go for it. By the end of the day, you should feel satisfied and optimistic about your treatment plan. As Dr. Suresh Kumar advised, get screened once in a year, make it a practice. Breast cancer is curable if detected early. Next Thursday, let us catch up again on an interesting topic. Till then, thank you so much. Thank you so much, Dr. Suresh Kumar.
Thank you, Arun. Thank you.